So I'll begin with hand hygiene. There you go. And I'm going to enter the patient's room and introduce myself. Hi, how are you? My name is Jennifer Polis. I'll be your nurse for today. I'll be performing a wound dressing. Is that okay with you? Yes, I had gained the patient's consent. May I please check your ID badge? So I'll be checking for first name, last name, date of birth, and hospital number. Great. Now, could you just tell me your first and last name? It's Buddy Wilson. Okay, great. Thank you. So before we begin, I'm just going to verbalize the bed at my waist height, and I'm going to verbalize my tray at waist height. And then from there, I'm just going to grab a blue pad. And I'm going to be tucking it right underneath your thighs. There you go. So I'm just going to tilt your leg just in case when we do irrigate and if there's any leakage, the blue pad would catch it. There you go, perfect. And then from there I will be grabbing my garbage bag. So I'm going to get my sterile tray. I'm going to place it down. And this will be my garbage bag. I'm just going to be grabbing some tape. And I'm going to be placing it at the corner of my table side. There you go, perfect. And then now before we begin, I'm just going to be performing hand hygiene. There you go. And I'm going to be putting on a new set of clean gloves. And then now I'm just going to remove the old dressing. So Buddy Wilson, I'm just going to remove it gently, very slow. There you go. So as I can see that there's blood that's leaking from the outside and blood from the inside, but it's dry blood. So I'm just going to dispose it. And I'm going to gently take out the packing strip. As I do see some blood and it's dry too, I'm just going to dispose of it. And then when I dispose of it, since the wound is ready now, I'm going to begin to remove my gloves. And I'm going to be performing hand hygiene. Now I'm going to begin to open my sterile field as I'm going to be grabbing the first tip and I'm going to be opening it away from me. And then my second, and the third. And just before I grab the fourth, I'm going to grab my tweezers. And then I'm going to gently grab it. And then I'm just going to adjust it to the way I like it. There you go. And I'm just going to remove this down here. This is just extra. I'm going to move my next two tweezers into here. And then from the 2 buds and up is considered sterile, and a little centimeter down is considered contaminated. And I'm just going to place it right here, 1 centimeter. There you go. And then now I'm just going to be adding everything to my sterile field that I will be using. So my compound pad. There you go. I'm going to dispose of everything. My 4x4 surgical sponges. There you go. Dispose of it. My Blinton needle. Perfect. My syringe. There you go. And then I'm going to be placing my sterile cotton tip swab gently down. There you go. Dispose of that. And then now I'm just going to fix everything. Making sure. There you go. And I'm just gonna place my tweezers back down. And then now I'm going to grab my packing strip. I will begin to open it. There you go. And then I'm going to be grabbing my sterile scissors. And I'll be placing it down right there. So as I open my sterile packing strip, I will begin to grab my tweezers and grab as much as I had taken out from the womb originally. Sorry. So there you go. I think that's about perfect. And I'm just going to be placing it right here, dropping it in. Perfect. And now I'm just going to be I'm going to be placing this right back down here. I'm going to be closing up my packing strips. Place it right back down here. And now when I do that, I am going to be grabbing my saline. And I'm going to be, before I pour it in, I'm going to pour some in the garbage, making sure it cleans the outside and the inside before. There you go. And I'm just going to be placing it in. As I had poured it 3 to 4 centimeters above the tray because I want my ribbon gauze to be soaked in saline. There you go, perfect. And now I'm going to be adding I'm going to be putting on my sterile gloves. There you go, I'm going to put the package down. I'm going to dispose of this, perform hand hygiene one more time. There you go. So for the sterile gloves, the outside is considered contaminated and what's inside is considered sterile. So I'm just going to gently making sure that I don't contaminate it. I'm going to gently place my fingers right inside. There you go. So I'm going to take my dumb hand first and I'm going to grab it from the inside, place my hands in, making sure it slowly fits and I do not contaminate anything. There you go. And then now I'm going to take my 4 fingers, place it in, making sure I do not contaminate it too. And as I will take my time and put it in. There you go. I'm just going to fix up my hand right there. And now I will begin to take my syringe and attach it to my needle. And I will begin to withdraw the syringe full of normal saline. There you go. And I'm just going to bring it right to the patient. And I'm going to begin to do a zigzag, making sure it does not touch the patient's skin or womb, or that will be considered contaminated. There you go. There you go. Perfect. It looks clean. As now I will be taking my syringe and needle and I'll be disposing it into the sharps container. And I will now I will be checking the measurement of my wound, my length times width times depth, by using my sterile cotton tip swab right here. And I will begin with my length. Just making sure the cotton tip does not touch the skin or the inside. There you go. And I'm just going to bring it right here to my measuring. There you go. It's a 3 centimeters, and then my width would be 1, and then my depth, making sure it does not touch anywhere inside the skin. There you go. It'll be 1/2 inch. So my length would be 3, my width would be 1, and my depth would be 1/2 inch. And I'm gonna dispose on my cotton tip. There you go. And then now I will be taking my sterile tweezer and making sure my ribbon gauze is wet and saline. Okay, great. Okay, great. Now I'm just gonna be grabbing it with my 2 fingers, just like that. There you go. And I'll be putting in my ribbon gauze, just squeezing the gauze just a little bit to begin, before I begin putting it in. And I'm gonna be taking my tweezers and I'm gonna be placing it right here. So just making sure. And then as I bring it to the womb, I'm gonna be grabbing my tweezers and just gently bringing it in, making sure that the ribbon gauze does not touch the outside of the womb. So I'm just gonna gently put it in. Gently put it in. There you go. There you go, perfect. There you go, I'm gonna be placing this right here. And then now I'll be getting a couple 4x4 womb, 4x4 package, so it can cover it and making sure it's clean. I'm gonna be placing it right here. Just gonna be adding one more. There you go. Perfect. I'm gonna place this down right here. As I am now gonna grab my ABD gauze. And for this step, I'm just gonna be placing it down right there. And since this step is impossible, I'm gonna be removing my sterile gloves. I'm gonna be performing hand hygiene. And I'm gonna be grabbing some tape. So Buddy Wilson, how did you feel? Did you feel any pain? No pain. Okay, that is great. Just discomfort. Yep, that's fine. There you go. And enjoy the rest of your day. There you go. You are ready and set. So thank you for watching my video. I hope you enjoy. Have a great day. Bye.